I grieved my life when I was hit with my recovery the first time from my eating disorder. I grieved the life that I had prior to kids 3 times because every time it gets harder and easier. It's very interesting, but like you become such a different version of yourself, and there's still part of you, or for me personally, that, grieves the life that maybe I didn't appreciate enough prior to having kids, right? And now I have so much grief for the mental state that I had only 2 months ago. It was only 2 months ago, right? Like 2 months ago, prior to going through this may sound wrong, but I'm going to say it anyway. I never worried about myself because I took care of myself. I worried about
Yeah.
my kids from the
Yeah.
moment they took their first breath, from the moment I
Yeah.
found out they were growing inside me. I worried about them. I've always
Yeah.
worried about my husband because,
Yeah.
he has chronic illness as well. So I've always worried about my family, never myself. I've done what I needed to do to take care of myself. And now I have this layer of like, why the fuck do I also have to worry about myself?
Well, and I think there's something to like feeling invincible, and I think,
Mhm.
like just to name it, right? I think that there's probably a privilege in existing in a
Yes.
societally acceptable body,
Yes.
whereas like I cannot imagine that like something that was like not caused by my fatness not being blamed, like of like, well, oh, also maybe you should try to lose weight.
Right.
And so
You're
the
so
fact
right.
that that doctor was like this, there was nothing you could have done. There was nothing that you could have done differently. And we will start to do that when we are scapegoating our bodies of like, I just want to feel safe in
Right.
my body. Welcome to the Body Grievers Club. Hi, friend. I am your host, Bree Campos from Body Image with Bree. I am a fat positive body image coach, educator, and trained mental health counselor. My goal is to help you stop hating your body and learn how to move through unavoidable body grief. This won't be your average body image advice. No affirmations, no fluff, no filter. I am prepared to say the quiet parts out loud. And no matter how overwhelming or hopeless your body image feels, you belong here. Welcome to the Body Grievers Club. Hi, and welcome back to another episode of the Body Grievers Club. As always, I'm going to let my guest introduce themselves, but I am so excited to bring my fellow Jersey girl, my friend, and my colleague, Jenna Werner, to the podcast.
Hey,
Hi,
we're
Jenna.
neither of us are wearing leopard. I'm so
I
disappointed in us.
Such a missed opportunity. I got the fuchsia pink nails, though, so we're good.
Yeah, the blue shiny, like the sea. Brie, I'm so honored to be here. You and I have so much history, and I'm so grateful for the opportunity to just be a guest on your podcast. I've never been one.
I know, but that's because as always say, I'm a casual podcaster, and you guys had me on your podcast
3 times.
3 times, and I was like, wow, I've been lapped. I need to get on this. But
Right. You were our favorite interview always. And like to this day, I our interviews with you have significantly impacted the way that I show up as a dietitian, and I will forever be grateful for you.
oh my goodness. Well, I'm going to link the episodes of the podcast in the show notes. Definitely, for those, if you go back and listen, man, they say if you don't look back at your old work and cringe, you haven't grown. I'm sure that there's stuff that I'm like, ooh, I don't know if I would still stand by that. Like I didn't have a definition for body image back then. I was figuring it
Our
along with
podcast
everyone.
started as called Drunk Dietitian. Like the embarrassment lives in my soul. Okay. So also
I almost
RIP to our
recommended.
podcast. But
I
like
almost recommended we have like a drink today while we're chatting. And I was like, maybe not. Maybe not. Oh my goodness. So I
my
did tell.
oncologist did encourage me to have drinks though, which I know we're going to talk about this, but I told him, I was like, I'm sober and like I still got cancer. And he was like, have a drink.
Oh my gosh. We're gonna get into all of that. You recently got a breast cancer diagnosis. And so I want to talk about body grief, body image, all of that stuff. I want to tell people a little bit of how we actually know each other. It's
So funny.
such a small world. Okay, so back in the day, before I was Body Image with Brie, I was an in-home intensive in-community therapist, which means for kids between the ages of 4 and 21. I would go into their homes and figure out like, hey, how do these people need support? And I ended up working with a person who I recognized had an eating disorder. And because they used community services, the only place that I know in New Jersey where you can get free dietetic support is ShopRite.
Shout out to ShopRite.
Shout out to ShopRite. And so I went with my youth to ShopRite and worked with this dietitian. And so from there, then that dietitian
The chills.
brought me in to, were you at that thing that I presented at the
I had
ShopRite?
just left, but that was my team. So that was in Sarah's supermarket. Shout out to Lindsay and Sarah, the absolute champion for nutrition at ShopRite. She is the best, and still there. But that was my old team, and I had literally just left.
Wow. Wow. And so then you knew business
Yes,
coach, Joe, who
I
wasn't my business
hired
coach at the
Joe.
time. Oh my
So
God. I'm
it's what's
so
even funnier is Joe. I hope you listen to this, but Joe was the intern at Wakefern, which is ShopRite's like
yes.
umbrella corporation.
Yeah.
And she, when I first started at ShopRite, I was one of like the first 50 dietitians in the ShopRite name. And she was so kind to me. Like, I will never forget the kindness that she showed me. She was just like, her Spitfire, like beautiful soul. And she was so good to me. She then went and she finished her internship. And then when she was looking to be a dietitian at ShopRite, I was like, Lindsay, we have to hire her. Like, she's
Oh
the
my
best.
God.
And then look at her now. I mean, she's
Wow.
10x herself in so many ways. But
100%. 100%. Now, when you left ShopRite, were you a health at every size dietitian at that point?
you know the answer to that
I'm gonna say that's a hard
question.
no. So how did you come into, like, when did you start learning about?
Our podcast. So during it was like 2019, early 2020, pre-COVID, I had visited Sam Previtt, who you also know, Find Food Freedom in Florida, and we had this idea of starting a podcast. And my nutrition handle at the time was Happy Slim Healthy, not proud, but that is the truth. And she looked at me and she was like, I love you. I want to do this with you, but I absolutely cannot start a business with you with that name. And I was like, you're right. And I hate it. And I've wanted to change it, but like everything else is taken. And Happy, Strong, Healthy is taken. To this day, I've messaged that person like 1,000 times, like, give me your handle. But I changed it to happystronghealthy.rd, which has stuck ever since, and started doing the work then. I always believed in that work, but
Yeah,
like, there was money in where I was. I was working in a
absolutely.
gym. People
Mm,
were coming to me for all the wrong reasons, and switching up my practice at that time took a big risk financially, but
100%.
it morally was the right thing for me to do. And we've never looked back.
Wow. Oh, I find that like, even the ShopRite dietitians, like I was going in to do a presentation on eating disorders and I was terrified that they were going to like throw like vegetables at me. Like I was so scared. And I was just greeted with nothing but like kindness and respect and like people who wanted more. And even I'm going to shout out Megan, who was the dietitian who sort of like hooked me up
Yes.
with everybody. Like she was so amenable to like the suggestions that I would give to make it more inclusive to people with eating disorders. And she's like, we just were never trained in this. And so
Not
it
even in school.
no,
We touch on
no.
it. It's like a doctor that gets 10 hours of nutrition. We get like 10 hours of eating disorder. It's
Wow.
the truth. I mean, you really have to truly find a specialist, like somebody that goes beyond the 4 to 5 years of school to
Oh,
really be informed, not only trauma informed, but eating disorder informed and then specialized. I had
wow.
this conversation with one of my dietitians on my team today. Like, she is my specialist because she's
Mm,
working in and consistently seeing and training and educating herself beyond what we learn in school because it's just not
wow.
enough.
Wow. Wow. I mean, even as a therapist, like the training, like I work with people who are quote unquote trained in eating disorders who are still also pursuing weight loss and supporting, intentional weight loss, which if this is the first time listening to my podcast, we believe in the right to body autonomy. If you are on a weight loss journey, you are entitled to do so from a health at every size and a weight inclusive approach. I like to speak to the people who are like myself, who an intentional weight loss journey is not safe for them to pursue because it leads to disordered eating and eating disorder behavior. So, but yeah, I think that more dietitians than not are open to what they don't know. And so, I mean, you were one of the first people to sign up for my supervision community. I think I came on your podcast and then you were like, I want to learn from you. And I shot my shot. I was like, oh my God, they're gonna be like, what do you mean you're gonna open supervision? And I filled
The
up
best
that
decision I ever made.
supervision in seconds. And you were, I think, one of the first people to
And
respond.
one of my best friends to this day was also on that screen, and we didn't even know each other yet, and we still talk about it.
Oh my
So,
gosh. Oh my goodness. Okay, so tell everybody about a little bit about who you are in case they don't know what you do now. So you're
happy, strong, healthy.
happy, strong,
.rd.
happy, you're happy,
Boomer.
strong, healthy. RD. Tell us a little bit about your work.
So my name is Jenna Werner. I am a registered dietitian. I'm also a mom of three, and I'm also a recent breast cancer. I think I'm a breast cancer survivor for sure, but my journey is just beginning in the breast cancer space. I own and operate and founded a private practice, which now has 9 registered dietitians. We take insurance in 15 different states. We do specialize in disordered eating. We have one registered dietitian on the team still that specializes in eating disorders. And we are also very supportive of meeting you where you are and helping you incorporate health promoting behaviors that will improve your health first, because we are a health and behavior first practice. So we
And
can,
to shout out your practice, you all recently, at the time
yes,
of this recording, just completed my body image boot camp. And like, I just love being able to provide the body image resources that can offer to dietitians like yourself. And yeah, I mean, I hope your dietitians loved it. I hope it was new information that you
it would.
didn't once
Bree,
have.
we learn none of that in school.
Yeah.
And in the world that we live in today, your voice and that education is so needed. And the girls took so much away from it that I'm so grateful for the opportunity to have provided it for them and for you to have provided it for us. So I cannot thank you enough for that. And we
Oh,
are a weight neutral practice, and we are living in a world where that is tougher to quote unquote sell.
absolutely.
So like you have shared before, we believe in body autonomy, and wherever you are in your journey, whatever it is you're pursuing, we will help you put your health first.
Yeah, absolutely. And I think, especially as dietitians, right? Like one of the things I talk about is like when somebody comes to me as a body image coach, a body image therapist, and somebody who talks a lot about body grief, they recognize when they're grieving. They're like, I know where I'm at. When they come to you, they might not even recognize
No.
grief yet because they're still in what I call the bargaining phase of like,
Yes.
no, like it's fine. Like that's like we can still fix this. And the reality is like when we talk about being, weight neutral or I'll say weight inclusive, is that I actually don't know what your body's going to do. I have no idea. But if we put all of our marbles in the jar of like, yeah, you do these behaviors and you implement these behavior changes, and absolutely, this is the results you're going to see. I believe we're setting you up for failure. And that a lot of dietitians will say things like, well, why don't we just put your desire of weight loss or your fear of weight gain on the back burner? And let's just focus on, intuitive eating principles or which is great, except when and if your body changes, then you're like,
Right.
hold on, this is no longer on the back burner. How do we make sure that we're not, just trying to say people like close your eyes and then just follow me and everything's gonna be okay?
Right.
Because I think we
So
can we
true.
can do both, right? We can hold people where they're at and also be realistic about what we know is possible and maybe even leave space for what we don't know is possible.
So true. It's such a good way to put that.
Thank you. Well, speaking of not knowing what is possible, you, somebody who arguably is a very healthy individual. I mean, I always see you working out and you are eating vegetables, like, right? Two health promoting behaviors that most
Yes.
clients want to adopt. And you were just diagnosed with breast cancer.
And I will say this, and I posted this. I actually went back to the gym for the first time since my surgery on Sunday, and I was thinking about it
Yeah.
and I shared this on social 2 times in my life where I was what society determines the healthiest version of myself.
Wow.
I have been the sickest. And the first time is very different than the second. The first was an eating disorder, was mental health, in the toilet. I was arguably orthorexic in addition to exercise bulimic, like self-diagnosed. I was physically what people consider to be healthy, whereas a doctor looked me dead in the eyes and said I would never have children if I didn't gain weight. I was diagnosed with PCOS. I was not ovulating. My skin was a mess. My hair was falling out, but people were telling me I was their quote unquote goals, trigger warning. And that was the fuel to my fire that, like, I'll never forget the day that I looked that doctor in the eye. I took his paper and I drove myself to the gym. Like, I've shared that previously, like I was unwell, but I was considered quote unquote healthy, right? So there was that moment. And then this time around, I was postpartum with my third, about a year postpartum. My body had been pregnant or postpartum for 4 years straight. I was finally mentally feeling like confident in my work, confident in my schedule. I had childcare lined up. I was giving myself enough sleep and, hydrated, eating my fiber, prioritizing my protein and vegetables, doing all of the things that as a mom, I was carving out time for myself. And I was feeling really good about the decisions I was making for my health. To the point where in January, I got a skin check. I went to all of these specialists for doctors. I got a new primary care doctor who was running labs, and we were all excited to, make sure my lab work was as good as we thought it was going to be, all these things, right? And I was going to do something for myself, body autonomy. I was going to get a breast augmentation, something that I had thought about for many, many years. And at a doctor's appointment, my doctor said to me, he was like, I realized that we're a couple weeks from surgery, but you're 38 years old, you don't have a baseline mammogram. I'm not going to perform the surgery until you get your mammogram. And I was like, no, like my surgery is in 2 weeks. Like we've been talking about this for months. I have no family history and I'm not 40 yet. So like, do I really have to? And he was like, if you don't get this mammogram, like I can't perform the surgery. So I was like, no problem. I went that day I got me an appointment that afternoon at just a women's center at the local hospital. And lo and behold, breast cancer. Like,
Which I'm
out
like,
of nowhere.
I'm pretty sure your mammogram ended up being scheduled the same day as like boot camp. And you were like, hey,
Yes.
just going
Yes.
in. Like you weren't worried. And
No.
then tell us what happened. Yeah.
So that first mammogram I went in, I remember emailing you like, oh, I'm so sorry, I'm gonna miss this. Like, not
Yeah.
a big deal, just getting something checked out. And
Yeah.
then that was a Friday. That Monday, the women's center called me back. They're like, hey, we see like a calcification on your mammo. We're gonna have you come back in for repeat scans. Like, we want to get like a couple more scans of the left breast and possibly an ultrasound. So I'm like, okay, whatever. They squeezed me in that Thursday. And in my head, I'm like, oh my God, my surgery is only a week from now. Like, what's happening? I wasn't even thinking that I had cancer because to me, I'm like, oh, I breastfed. So maybe calcification, old milk, like whatever. Like I just mentioned, I had just gotten lab work done from my primary care physician and like my white blood cells, my red blood cells, my lymphocytes, everything was fine. So I'm like, not worried. Went back in. This was a Thursday. And the vibe in the room when they did the ultrasound was off. Like, when you just like know, like they're talking about you and they're trying not to, and she's not looking at me. And like, I'm like, hey, do you have something to say? Like, and they're like, oh, like the nurse manager is going to come in and talk. Like, we'll just talk about next steps. And I'm like, what do you mean? And they were like, I think you're going to need a biopsy. And I'm like, of what? And she like scrolls in or like zooms in on the ultrasound or the mammogram image on the computer screen. And it's Brie, when I'm telling you, it was 3 little poppy seeds, like little chia seeds in like a little triangle. And I didn't realize I have dense breast tissue, which it's harder to find things in dense breast tissue. I had like the smallest boobs ever. I figured like breast cancer was never on my radar because I'm like, I don't have any breast tissue. Funny, out of the 100 cc's that they weighed my boobs after the mastectomy, I apparently 30% of it was cancerous. Anyways, I'm getting too far ahead of myself.
Yeah.
But so those 3 little dots, they were like, we're going to biopsy them. And, at that moment in time, I was very emotional and I had words that I'm not proud of with the nurse manager because I felt very judged by her in that moment. I felt a lot of shame. This is my own internal feelings. But when she said to me, we're going to do a biopsy and my next available appointment is February. It was like, this was February No, I was diagnosed on February 2nd. So this was January. Let me look at the calendar. This was January 30th. And she told me the availability for my biopsy was going to be February 27th. My surgery for context was February 5th, was the original surgery.
Sure.
So I freaked out. I'm sorry, this was January 29th. So I freaked out. I had words with her and she said to me, I know you must be really disappointed because this is going to cancel your surgery. And I lost my mind and I was like, I am not disappointed. I am frustrated and terrified. I am a mother of three. I'm a
Yeah.
young woman and you're telling me that I could potentially have cancer and you're going to make me wait a month with my thoughts to just think
Wow.
about it before this process starts. So I advocated for myself,
Good.
inappropriately and also like proud of it in the end.
I
But
think it
long,
was very appropriate. It was
like
she made an assumption, and I think bedside care is a whole other thing we could we could get
we
into.
could dive down.
But that is not trauma informed at all in the way like they did
It
it.
was
But
felt very judgy. I felt a lot of
100%.
shame because I had already felt shame about the decision that I was making to do this surgery. Like it was something that I really wanted, but I was worried about the perception of others. And I think that's part of like my journey and my learning of like being confident in the choices that I make and, standing by and understanding the intentions behind my own choices. And again, standing by my decisions. And so from that moment, they got me in the next day
Good.
on January 30th. I had my biopsy. And on February 2nd, I was sitting in my car. That was the following Monday. I was sitting in my car about to go have lunch with a friend who I hadn't seen in a while. I like never plan lunch dates. Unfortunately, her husband had recently passed away from cancer.
Oh my God.
And it was just like a weird way that this
Yeah.
was all, happening. And I got the phone call. My doctor's name popped up. Shout out Dr. Samra. He's on my pen right here too. And he was like, he took a deep breath after I was like, oh my God, what do you have to tell me? Like, am I going to see you next week? Like all excited. Again, cancer was not in my like realm of thought. It doesn't run in my family, etc. And he took a deep breath and he said, I'm sorry. We found cancer in your milk ducts. It's not something you could have felt. It's called DCIS. It's in situ, which means it was literally confined and not invasive in the milk ducts. He called it a miracle that it was found. He said that the radiologist who was going to call me was going to explain everything, in more detail, and that he was going to put me in touch with an oncologist. He'll set it up for me and call me back. I closed that phone. I ended the call, broke down. And then I think from that moment on, it was just like a whiplash turn of like everything happened really fast after that. And I come to find out that the radiologist, when she called me a couple hours later, was like, Jenna, I don't think you understand like the grade of the pathology that came back, in addition to, the amount that was found. Like, if you waited until your 40th birthday to get that mammogram, we would be having a very different conversation right now. But because you found it when you did, it's going to be not by any means easy to fix, but we're at stage 0. It
Wow.
is treatable and we're going to have a plan and you're going to be great and blah, blah, blah. I felt really good about that decision, but also like my mind was racing. Like if I had waited till I was 40 and I couldn't feel it, it could have become invasive. It could have invaded my lymph nodes. It could have invaded other areas of my body and I wouldn't have even known. And that is terrifying to me. And also just what the F, how does this happen? But from that moment, I also my oncologist ended up scheduling me for an MRI and blood work. And I got the MRI and we found that those 3 little chia seeds was actually cancerous tissue covering 30% of my breast, 30% of my small A cup, which made it so that a lumpectomy was not possible because it was covering so much of the tissue that a mastectomy was the only option for me. Whereas I then electively decided to do the other side because there is a high rate of recurrence with DCIS for the other side. So I wasn't going to put myself through surgery more than once. So I did that. That was the decision that I made. But with that said, I then also got genetic testing done and found out I do not have the BRCA gene, which is what everybody thinks about with breast cancer, but I do have a gene mutation called CHEK2, which is connected to breast cancer and prostate cancer. So now, yay, I get to worry about my three kids with their prostates and breasts, which is just not something I ever envisioned for my family. I don't think anybody does. I'm also grateful though, because they'll be highly watched now.
Yeah.
But because of this, my cousins have been tested. My mom just
Wow.
got tested. My cousin found out one of my cousins has the gene, and my mom just found out that she has the gene as well. And so, because of this decision that I made and this like butterfly effect that has happened, now gratefully my mom and my cousin will be highly watched. They'll
Yeah.
have an oncology team, they'll be able to have the conversations that people don't want to have, but be under somebody's care. If God forbid something is found, it will be found early. So it's this bizarre and effed up silver lining,
Yeah.
that I'm grateful that I was the one to take it for the team, for the family, but also like, what the F? Like,
Honestly.
like what the F? And what I struggle with so much too, Brie, is like from the body grief perspective, is not only like everything my body has been through and the scars that I carry and everything else. And grateful that my lymph node they did take out my lymph. So I have a scar under my armpit too, to sample that it had not spread, which I'm super grateful for. But like people say, and this is no fault of anyone, but people call breast cancer like, oh, you're so lucky it's just breast cancer. And oh,
Mm.
you had the mastectomy, so you're fine. You're getting the boobs that you wanted. Sure. But like I amputated my two breasts. Like,
Like at
and
what
this is an
cost?
amputation
Wow.
of two body parts, right? Like on my body, that I now have this foreign object in my body right now, expanding the tissue that I've shared a lot about on social, but like every week for the past 8 weeks, I had needles in my chest, adding saline solution to stretch out the tissue to get the tissue ready for the next steps. And I actually asked the doctor yesterday, I'm like, why does my left breast, which was the cancer side, still look so beat up? Like it's bruised. Like I
Mm.
actually sent Sammy a picture of this right before this call. I was like, look at my boobs. Because she asked me, like, how are you doing? And I
Yeah.
showed her, I'm like, it just looks like the entire breast is bruised because the surgery was so complex. And so they found the cancer was not only in all of that tissue, it went all the way back to my muscle. So they actually had to cut the muscle. It like
Mm.
touched the muscle and went all the way forward to the skin of the breast. So like they had to snip out some of the skin of my breast as well and stitch that back up. So I have these scars there, and it's bruised because there's no nerve endings, and like the nerves are regenerating and I have no feeling in them. Like at
Yeah.
all. And like, it's just like, I feel like I'm wearing a bra right now because I can't feel this, but I'm not.
Yeah.
And so it's a very weird thing. And on top of that, it's like the mastectomy wasn't a cure. And I think people also don't understand that like
Yes.
I did this radical choice of cutting off both of my breasts,
Hmm.
thinking in my head that that was it. Now I'm cured. But now, fast forward, my margins were clear, quote unquote, but they weren't zero. And what that means is, and the way it was explained to me is that when they sample, the cells that are remaining in your skin, like it was less than like 2 millimeters or whatever, like the whatever it is. I don't want to misspeak, but it cleared like safety margins, but it wasn't zero. And they can't get every single cell. And because my cancer was estrogen positive and I have not gone through menopause yet, there's still estrogen in my body, high amounts, around our period and our cycle, and it goes up and down. And that estrogen feeds the type of cancer that I had. And so if estrogen bound to one of the mutated cells that are still swirling around in the very little cells that I have left on the tissue, it could cause a reoccurrence, even though I don't have much breast tissue left, right? So now we have to have this conversation about medication to suppress estrogen, which could have side effects similar to menopause at 38 years old. And it's like, holy shit.
Wow.
So
Wow.
it's just, yes, it is quote unquote a better cancer to have. It's still cancer, and it has
Yes.
completely changed not only my mental health, but also my physical health for
Mm.
the rest of my life.
I think when people say like, "Oh, it's a better cancer," it's like how a lot of times people try to like quantify trauma of like, "Oh, well, like that's not that bad." You know what the body doesn't give a fuck about
Right?
is
What type?
what type of trauma you have. So whether you are being chased by a lion or you're taking a test, your body recognizes fear when it experiences it. And
Yeah,
so, I mean, what a shift from going from this autonomous, like I want to make this change for my body to I am making these choices because I want to mitigate any long-term consequences. Like it's no longer a choice and it is
exactly.
self, preservation. When you got that official diagnosis of like, yep, this is cancerous, what what was going through your mind?
I didn't believe it, if I'm being honest.
Wow.
I
That's
like,
the denial of the
right? The
body.
denial was there, and
Yeah.
then I went through all the stages of grief. I was so angry, like
Mm.
so angry because I had, you know, my baby was just turned 1, and the last 4 years of my life had been nothing but as they should be, taking care of everything that needed to be done for my babies. And I finally had made this decision of doing something that I wanted to do for me. And I saved up and I worked hard and I did all of these things. And I like told my dad, that was like one of the things I was scared of. Like I like didn't want to tell my dad I was doing this, right? Like I have such a great relationship with him and I didn't want to disappoint him, which is my own shit. But
Yeah.
I had gone through all of these things and I was excited and I was feeling good in my current skin
Wow.
of like confidence in my motherhood journey and confidence in my career and confidence in, the choices I was making for my family. And this kind of hit me like a ton of bricks. And it was more so this anger because cancer has touched my family a lot. I lost
Mm.
my best friend and my cousin within months of each other when I was in high school. Very different cancers, but like to me in my head I was like, okay, like cancer has messed with my family a lot, like we don't have to worry about that. Maybe that was a different phase of denial, but like never in my life did I think it was going to be me because again, like we said before, I was doing all of the health promoting behaviors. And I think one of the things that is really a tough pill for everyone in this world to swallow is we don't have control over our genetics. We don't have control over a lot of things in our health. And whereas social media and the sphere of health, that I see online where everyone's like, it's the seed oils or it's the like,
It's
you,
yeah.
it's not, right? And
Eat
I
more red
actually,
meat.
right, exactly. Eat a stick of butter and you'll never get cancer. Like, no.
Yeah.
Actually, that's a fast track if you ask me, but we won't go there. But I actually said to even having all the knowledge in the world and knowing all of these things, like I looked my breast surgeon dead in the eyes, and she's very into nutrition. She actually partners with ShopRite dietitians, which I
Ah,
loved. I know, such full
amazing.
circle, right?
I love
Um,
it.
but I looked her in the eyes and I was like, Dr. Patel, like, is this because I put Splenda in my coffee every day? Like, is this because I stopped drinking alcohol and started drinking Diet Cokes? Like,
We're
and she
Jersey
was
girls. We love our Diet
like,
Coke.
wait, you're not taking that away from me. And she was like, I understand why you're asking these questions, but
Wow.
no. And
Yeah.
like, you need to believe that and you need to hear me and you need to
Yep.
know that, like,
Yep.
your genetics worked against you here and nothing you could have done
Yep.
was going to stop this from happening. However, going back to why we engage in health promoting behaviors, she was like, your recovery will be impacted by the way you continue to make choices for yourself. And, how you feel in your recovery physically and mentally will depend on, the choices that you make for yourself and your health. And that I really took to heart because it feels like an autoimmune disorder, right? Like your body's working
Mm.
against you. And that's
Wow.
a shitty feeling and it's a scary feeling. And you have two decisions in those moments. It's like, do you back down or do you stand back up? And you know me, we're from Jersey. Like I don't back down to anything.
You told me to back down. Now I'm going to push even
I'm
harder.
going to
I
fight.
quick joke about Diet Coke though. My clients are always like, Brie, like I think you should try regular Coke. I think you'd like it. And I'm like, I don't think you
No.
understand the cult of Diet Coke. Like the way that it just fucking hits. I can't.
Every time. Every
Every
time.
and like
Every time.
controversial, but like from McDonald's, like the
Yes. Oh,
supreme.
there's
Anyway,
absolutely, I honestly, Chick-fil-A too. Like the Chick-fil-A
yes.
Diet Cokes, like they're
Or
bigger.
AMC, the movie
Like,
theater, like
yes.
it just
Like,
is that
uh,
fresh and like and it's like it's a choice. Like I want like this is what I prefer. I have clients that are like, I prefer the sugar-free stuff because if they have had diabetes and they were, told like, oh, you should only eat sugar-free, and now they're intuitive eaters, they're like, I kind of like the taste of the sugar-free stuff. I'm like, that is so wholly different than like I
yes.
need to be eating this because this is better or healthier. I think it's such a hard pill to swallow for most people with autoimmune, with chronic illness, that with illness in general, you can do all of the right things and you can still get sick.
I mean, I'm a perfect example of that. Like, and please, I haven't done all the right things, but I really, my husband and I proactively, when I was pregnant with my third, he stopped drinking altogether because he had nobody to drink with. And then when I was postpartum, we chose not to drink. And that, I mean, alcohol is carcinogenic. No dose of alcohol is health promoting. So I'm thinking to myself, I'm sleeping. I'm not drinking alcohol on top of all the other things that like I'm doing,
Mm.
I'm really taking care of myself and I was feeling mentally and physically very healthy. And this hit me like a ton of bricks out of nowhere. And the doctor, I mean, he truly saved my life, Brie. Like, and it's funny because he is a breast reconstructive surgeon is his specialty, which is why it is his policy to have this mammogram.
Wow.
But I was like he breast cancer is his specialty, and I was like, how
Yeah.
lucky for me, I have this guy with like all this extra training. But
Yeah.
people come in. I hate the phrase everything happens for a reason, but I think it's really beautiful to find purpose in the things that happen. And like I was meant to
Yeah.
cross paths with this man. And it's funny, not funny, but the way I crossed paths with him was actually the day that Sam Previtt, again, I hope she listens to this episode.
We'll send it to her.
She was on Good Morning America for the first time.
Cool.
And this was 3 years ago. So she was on Good Morning America for the first time. It was actually April. And my 2-year-old at the time, he's now 5, it was his nap time. And I was like, go get your milk in the other room. Like, mommy wants to watch Aunt Sammy on TV. This
Oh.
little boy like ran away from me to go get his milk from the other room. We were late for his nap. I should have just recorded it. He fell, he tripped, he landed on the corner of a plastic box and split his lip open top to bottom. Like it was flapping free. Like he had 3 lips. Like it was
Oh.
sliced open, blood everywhere. We went to the ER. The pediatric plastic surgeon was on call, but he wasn't coming into the hospital. I had to go to his office. Which doctor do you think that was? Dr. Samra. He treated us
Wow.
with such respect. He was so incredible to my son, made us so calm. I met him on that day. And when I
Mm.
decided I wanted to do this for myself 3 years later, I didn't even like look into any other doctors. I was just like, he made me feel safe and calm in that appointment.
Mm.
I'm going to book a consult with him because I trust him. And he did right by my son. He put 60 stitches in my son's mouth.
Holy shit.
Yeah, 2 years old. And, I think that day, 3 years ago, maybe we could say Sammy saved my life.
There you go. Well, and so you talk about like quote unquote everything happens for a reason. There's a book that I totally recommend people read. It's called Everything Happens for a Reason and Other Lies I've Loved. Because I
I
think
love that.
I think a
Write
lot of
that
times
down.
we do like to like silver line pain with like, but see, like look at all the good that's come from this. And the way I prefer to look at it is David Kessler, who worked very closely with Elizabeth Kubler-Ross on the stages of grief. After, many years after she died, his son tragically died. And he asked, the foundation if he could add another stage to the stages of grief, which was finding meaning and purpose. I'm gonna get
Yeah,
emotional.
I know,
Right?
because it's something that you feel like you not feel like it's something you really and truly have to do. Because if I let myself sit in the suck for too long on this, which I certainly did, and I had a really hard time mentally getting out of bed and parenting my kids. And, I numbed myself out of thinking anything other than what was the doctor's appointment I had to do that day, right? I leaned hard on people and people really showed up for me. And I'm so beyond grateful for that. But if I didn't see this as I've saved now my cousin and my mom, I don't think that I could continue to get out of bed. And I've now saved my daughter and I'm going to hold on to that because she will now start mammograms at 28 because I was diagnosed at 38. So she will have the opportunity to, be followed and tracked by the
Yeah.
right people at a much younger age because she's very high risk. And that sucks for her, but there's, purpose to this finding and it sucks. And you know what else I hate when people say is like, oh, you're only given what you can handle. Like, really? It's like I could survive on a little bit less, but like thank you for thinking so highly of me that I can handle this shit because
We only say that to women, honestly. Like,
you're right. You're absolutely right. But like, yeah, I mean, again, from like the grief perspective, it's like I've grieved my life a few times now, right? I grieved my life when I was hit with my recovery the first time from my eating disorder. I grieved the life that I had prior to kids three times because every time it gets harder and easier. It's very interesting, but like you become such a different version of yourself, and there's still part of you, or for me personally, that, grieves the life that maybe I didn't appreciate enough prior to having kids, right? And now I have so much grief for the mental state that I had only 2 months ago. It was only 2 months ago, right? Like 2 months ago, prior to going through this may sound wrong, but I'm going to say it anyway. I never worried about myself because I took care of myself. I worried about
yeah,
my kids from the
yeah,
moment they took their first breath, from the moment I
yeah,
found out they were growing inside me. I worried about them. I've always
yeah,
worried about my husband because,
yeah.
he has chronic illness as well. So I've always worried about my family, never myself. I've done what I needed to do to take care of myself. And now I have this layer of like, why the fuck do I also have to worry about myself?
Well, and I think there's something to like feeling invincible, and I think,
Mhm.
like just to name it, right? I think that there's probably a privilege in existing in a
Yes.
societally acceptable body,
Yes.
whereas like I cannot imagine that like something that was like not caused by my fatness not being blamed, like of like, well, oh, also maybe you should try to lose weight.
Right,
And so
you're
the
so
fact
right.
that that doctor was like this, there was nothing you could have done. There was nothing that you could have done differently. And we will start to do that when we are scapegoating our bodies of like, I just want to feel safe in
Right.
my body. And
Thank you for bringing that up. I'm sorry I didn't share
no,
that before because
but
you're so right.
it's still like if you had this idea of safety in your body and now that's gone, how do we rebuild that self-trust, knowing my body may get sick, my body may get cancer again, but you also are being vigilant. You are also have providers that are going to take, copious care of you. And I think also being a mom, right? Probably is going to make you want to show up even more so of like
They get
I
me
got to
out of
be
bed.
I got to be included in this group that I care about. I wanted to comment. I mean, there's so many directions we could go, but I think the one thing I wanted to sort of just drive home is like the idea of like, the health promoting behaviors that you engage in, not only helping your healing, but also maybe even being part of the like, oh, like I'm good. Your ability to continue those health promoting behaviors is because the motivation wasn't
My
external,
body.
right? It
Hmm.
wasn't, I want to look good. It's, hey, this makes me feel good. This makes me show up as a better parent. Like, I'm not 28 anymore, so maybe I don't need to drink during the
Or
day on a
binge drink.
podcast. But like, I think so many times people want to use the health promoting behaviors to beat their bodies into submission. And it's like, then when you have something like this happen, then it's like, well, then fuck it. Why was I doing any of it? And I think for you, it's like, no, I'm going to continue to take care of my body in the best way that I know how.
Because it's been through so much, and like I come back to that too, that look, I think we all there's like so many ways I want to say it, but I think for me, I abused my body and the health promoting behaviors in my
Right.
past for a
Yeah.
long time.
Yeah.
And I know what that feels like. And for me personally, the 45 minutes, maybe at the most, that I walk now by myself on my treadmill, I get to watch whatever show I want without somebody saying, Mommy, 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 or
The
my
joys
husband
of
asking
motherhood.
1,000 questions about the show that I'm watching that he said he wasn't going to watch. That, like, it's my alone time. And whether that is good for my physical body or my mental health, like, or both, like, that is what my my choice, and like the choice to continue to do them
Mm,
is selfish because I know it's time that I need for me.
mm,
And I do know that it has health benefits on the other end too. And I now have this perspective that, like, our paths are created for us, right? To some
yep.
extent. And there's, again, the genetic factor. I wish I didn't know about my
Mm,
genes. Like, I wish there's part of me that wished I could just like continue being blind to it. But now
true.
that I do, my goal in life has changed, and
Mm,
I want to advocate for women. I want to help women advocate for themselves. I
mm.
want breast cancer to be talked about more than just during October when we wear pink, because I knew nothing about it. And
Or
there's
when you're turning 40 and you need a mammogram.
exactly, and there's hundreds of types of breast cancer.
Wow.
Hundreds.
Mm,
I had maybe a good one that could have turned into a really bad one
wow.
because it's one that you can't feel. We're told to feel for lumps. I had
Yes.
no lump, and I
Wow.
wasn't going to have a lump
Wow.
because it was in my milk duct. So it's really these things that, like, maybe it's better if we don't know, but now that I do know, I'm going to share it, and I hope to
Mm,
continue to save more people from the agony. I mean, the surgery itself, like, I had 6 whole weeks where I couldn't hold my babies, and the surgery itself sucked. And I woke up and I felt okay. And the doctor was, I was like, I said to, I remember saying to the doctor when they came to check on me the next morning, I'm like, you told me I was going to be numb, and but I'm surprised that I'm still feeling so much. And like, I don't feel good. And he was like, if we didn't put this nerve block in you, I guess they gave me like a nerve block for 96 hours. He was like, you literally would feel a lot worse. And he was like, your surgery was so extensive that, like, you're lucky this is all that you feel. I'm like, okay,
wow.
okay, I'll
Oh,
sit back down now. Like,
oh.
like, it's not a boob job, right? Like, it's not the same thing. And again, there is, and I want to recognize all of the privileges that I hold besides physical body. Being a straight white woman in today's society holds so many privileges, and I recognize all of them, and I'm going to use them for good. And that is a promise that I will make. And I thank you for calling me in on that, because it would be absolutely negligent for me not to say that out loud. And I hope anybody listening to this episode also advocates for yourself. If you are not 40 yet and you have a family history, if you feel anything different, and I struggle to want to share this, but I think back retrospectively, and like, I was noticing changes in myself, Bree, that
Mm,
I was gaslit into thinking we're just
wow.
postpartum, we're just hormones, we're just maybe perimenopause because I'm almost 40. My mom went through perimenopause early. Maybe it was perimenopause, which was part of the reason I went to get a new primary care doctor to get my labs checked, blah, blah, blah.
Mm,
Long story short, like, my sweat started to smell really different. I was having a lot of hot flashes. I was so fatigued, like sleeping
wow.
8 hours, but waking up exhausted. And like, in hindsight, are these things that are signs of breast cancer? Who knows? Like, we don't know because we don't spend money on women's health, and that's a whole
Uh-huh.
other
Yeah.
conversation.
100%.
But if you're noticing any changes in your own body, you know your body best. And I just implore you to ask the questions, find a way to book the sessions or the screenings or see the doctors and ask, because maybe if I wasn't getting this surgery, but I trusted my instinct to know that something was not the same in my body right now,
Yeah.
maybe I still would have found it. But I'm grateful that I did, and I would love to be a resource for anybody who is going through this as well.
Yeah, I mean it's so like cliche, right? Like of like everything happens for a reason or but like I believe like this is going to be part of your story now. And I'm I'm getting emotional, but I'm so excited to see the impact that you have on other people's lives with your platform, with your message and in a way that is safe for all bodies. So, because I've seen some of the shit that you're posting about people like, oh, put this up your butt when
Did you
you're,
imagine?
I
She has
cannot.
500,000 followers.
But that's the
500,000.
thing, right? Right. So like,
Wheatgrass up your ass. Like, could you imagine? And that's her
so,
catchphrase, Brie. It's like, come put grass up your ass with me. Like,
oh God.
what?
Does she sell the grass too? Because if she does,
She
then
grows
that
it.
kind of like I'm like what like and I get when people get scared and they get
Yes,
sick, right? You're gonna
totally.
grasp at anything, and it is just much harder to reckon that you can do all of the right things and you still might get sick. Bad things might happen. I know we're coming up on time, but I remember like when this thought first came to me, when this thought first came to me was my voice teacher never smoked a day in her life. She died from vocal cancer, like from throat cancer. Never smoked a day in her life. You can do all of the right things and you can still get sick, and that is fucking scary.
So
And
scary.
we can still do health promoting things in a way that is healthy, not just for our bodies but for our minds. And if advocating for yourself with the doctors is hard, bring somebody with you. Find
Yes.
somebody who will advocate with and for you. I will always send letters for my clients. I'll even offer like, hey, if they'll let you put me on the phone, put me on the phone. Like we do what we got to do. So
I also just like everything that you just said is absolutely so correct. And it's so, so, so powerful to also be able to say, you know, I'm not going to take no for an answer. And I was literally at my OBGYN asking her about my symptoms and she brushed them off.
wow.
You're postpartum.
And you live in a privileged body. So
And I
like
live in a privileged body. I'm postpartum. And that was that.
there's
Okay.
no bodies that are safe from
No. I also recognize how brutally challenging the world that we live in today is with weight stigma and making people not want to go to the doctors because of the experiences that they have. And part of the work that I swear that I am going to engage in is helping to break those barriers. Because
mm,
if you are fearful of going to the doctor because of that, you are absolutely valid to feel that way. And it is preventative of you being able to take care of all of the possible things that could happen. And that sucks. And it's time to create change. And I've added it to my list already. And we'll see where we go with this. But it will be part of my life's work. I just know that.
well, I will be there with you and in that fight. Jenna, tell people how they can follow you, how they can work with your team. Give us all the good stuff.
So I am at happystronghealthy.rd until they give me Happy Strong Healthy as a handle. On Instagram, which is probably the best way to find me at this point. My email is jenna at happystronghealthyrd.com. If you are somebody who is, you know, going through a breast cancer battle, if you have questions about this, a mastectomy, etc., I would be happy to connect. I would love to connect with you. I am way better on email than I am on DMs. So, and Bree, so you should know that. I was the worst at DMs, and I'm so grateful that we've been able to reconnect outside of social media. And my website is happystronghealthyrd.com. We have 9 providers that take insurance in over 16 different states, which means that your insurance, most likely, if you're in one of those states, covers a minimum of 2 free visits. We have, I would say 80% of our clients have between 10 and unlimited sessions covered for free,
Fantastic.
where you can meet in your home on Zoom with one of our providers and just get your questions answered. So please take advantage of that. Thank you so much for having me and allowing me to share this story and hopefully impacting somebody's life today.
Thank you so much for being here. We'll put all of that in the show notes. Jen, I love you. Thank you for being
Love you
here.
more.
Hey, friend. Thank you so much for listening to this episode of the Body Grievers Club. Like all of our podcasting friends, we ask that you like, subscribe, and share this episode with someone who you think needs to hear it. I know that body grief is tough. but I hope this episode helped you to feel less alone. To learn more about how you can shift your body grief to radical body acceptance, be sure to check out my free 7-step guide designed to help highlight how you can transform your body image story. You can also learn how to work with me inside of the show notes. Remember, my friends, your body grief is painful and real, but you are never alone, especially when you're part of the Body Grievers Club. Thank you for listening, and until next time.